Continuing on from part 1, we are in September of 2025, and I have just extended my leave of absence with work in the hopes that I will recover and be able to at least return to part-time. I'm Natalie, the Ardent Autist, and I am fat, sick, and fed up. So far, I've mostly been giving details about doctors and nurse practitioners and such. I haven't actually mentioned the physical therapy in any detail, so I'm going to get into that now. When I saw my primary care doctor in January for the dropped head syndrome, he had referred me for that x-ray, but he also referred me to physical therapy. I was very familiar with the physical therapy at this particular hospital because I had gone through 8 months of it in 2022. When I went to physical therapy for the dropped head syndrome, I was evaluated and they determined that the neck symptoms and neurological symptoms that went with them were too serious for them to risk doing any kind of physical therapy for me. After I woke up with the left side hemiparesis and foot drop on January 27th, I went to physical therapy again, and we started trying to work on regaining some of my functionality on the left side. The only problem with that was that I was extremely fatigued already, and going to the physical therapy involved 40 minutes of driving and then all of the physical activity, and I was basically wiped out for 2 or 3 days after that. Since I couldn't handle doing the normal 2 or 3 days per week of physical therapy, we were scheduling 1 day every 2 weeks. My physical therapist gave me exercises to do in between visits, which I did as much as I possibly could, just because I really wanted to recover, and I'm always very compliant with that kind of thing. By the time I went and saw her for my appointment in September, though, I was beyond frustrated with all of the bouncing around that I had done to multiple neurologists and other specialties, and I still didn't have any answers. I shouldn't say I didn't have answers. We did rule out a whole bunch of stuff, and that is valuable, but I really need to know the root cause of what happened to me and whether or not I can actually get treatment that will allow me to fully recover. At my appointment on September 4th, my boyfriend actually went with me, and we did another evaluation to see where I was at, just to kind of gauge if I had made any progress and if we needed to change anything with the physical therapy. I had been doing quite a lot of physical therapy on my own at home, at least as much as I could tolerate. A lot of it was just kind of sitting in a chair or lying in bed and doing stuff, but I would do as much as I could manage. So I had made a little bit of progress with, for instance, being able to move my left foot more than I had been able to. And part of that I actually attribute to using not just the exercises, but also a TENS unit. When the physical therapist was evaluating me, we got into conversation about my frustration at not having any answers yet, aside from just ruling things out, and how I was really starting to think that I wasn't going to be able to recover because it seemed like nobody was going to be able to figure out what happened. She evaluated my range of motion with everything and my strength, and I showed her how I was able to move my left foot a little bit more than I had been able to before, and she made a remark that seemed really snippy, and it kind of upset me. She said, "My stroke patients can't do that." After the months of physical therapy and conversations about what was going on with me and all of the tests and everything that I was getting done, I thought that she had an understanding that, one, we didn't actually know what had happened yet, and two, that my symptoms didn't actually fit stroke. So when she made that comment, the body language that she had, the tone of her voice and everything, it seemed almost accusatory, and that was pretty upsetting. I replied saying that all of the tests and everything had not shown any signs of stroke, so I was probably dealing with some other kind of problem, which she should have known by looking over my records. That segued into a conversation about how I was waiting for the Rush University Hospital appointment and how I was also waiting for an appointment with the second neurologist at the new hospital, and how I was hoping that I was going to get answers there. and she started asking me if I was under a lot of stress when this happened to me. This is where one of my biases comes in. When medical professionals start asking a woman if she's been under stress in relation to any kind of health problem, that kind of gets my hackles up because it's one of the ways that people like to dismiss problems that women have. Mind you, I'm aware that it's not just women, but this is very common with women, and especially when their symptoms seem to be invisible. Everyone can clearly see that I cannot walk properly and that my foot drags the floor, but if I'm not walking and you're just looking at me like you are right now through this video, you wouldn't think that there's anything wrong with me aside from maybe some of my oddities and quirks because of my autism. So I asked her why she was asking me about stress because I was already very wary about that, but we had built enough rapport that I was willing to give her the benefit of the doubt. She then proceeded to tell me that stress can cause symptoms like the ones that I have. I want to make something clear to anybody who's watching this. Correlation does not equal causation. This is something that anyone working in a STEM field or adjacent to a STEM field should be taught in a 101 style introductory course. Stress has been documented as a catalyst for all sorts of problems, but stress is not a disease by itself. It is something that exacerbates existing problems. For instance, I've had several friends who have autoimmune diseases of all different types, like rheumatoid arthritis, type 1 diabetes, lupus, etc. And stress really does actually make their symptoms worse if they don't manage it. That does not mean that stress caused their rheumatoid arthritis or lupus. So when she told me that she thought that stress could have caused what I'm dealing with, I got a little bit heated. I went on a kind of mild rant telling her that not only have I been subjected to gaslighting and malpractice when I should have been taken care of, especially considering that I'm paying for all of this, but also that women in general tend to be dismissed for so many things that end up being deadly or permanently disabling, and that there is a term in the world of doctors for it. It's called diagnosis woman. When I finished with my little rant, she decided to double down on the idea that stress can actually cause disease. In that moment, I decided that she was not going to see reason and there was no point in continuing the conversation, so I decided to just let her know that I was done with the appointment. Since then, I've never been back to that physical therapy and I won't be going back. I mentioned in part 1 that the third neurologist at the new hospital network had decided to move to internal medicine, so I had to schedule with a different neurologist, and that neurologist didn't have any openings until November. So I scheduled an appointment for November and they put me on the wait list just in case there was a cancellation. Luckily enough, they did end up having a cancellation and I got in to see him at the end of September. On September 22nd, I returned to the new hospital to see neurologist number 4, and he was actually the guy who was mentoring neurologist number 3. When this guy walked into my room, I knew that he was old school. He was wearing a suit and tie, and that is something that you just don't really see anymore. He introduced himself and shook my hand and my boyfriend's hand, which was very polite and also old school. And he sat down at the computer and basically turned his back on us and started looking through my records. As he scrolled through and looked at test results, he would ask me a question here and there and then move on to the next one. This went on for, I think, about 20 to 25 minutes. I forgot to mention that he had a trainee with him, and I think this guy was going for residency, I'm not really sure, but he was kind of standing off in the corner quietly, looking very awkward. After he was finished looking through all of my test results and asking me questions, he turned around in his chair and told me we were going to do a neurological exam, starting with me walking. He held my right arm and helped me walk around the actually very small room and kind of going around the trainee and all of the obstacles in the room. and I was able to hold on to things, so my walking wasn't absolutely terrible. His neurological exam was very thorough. He tested all of my reflex points and he did test my strength. One thing I want to mention about the strength test, one of the things they like to have you do is grab onto their fingers with both hands. So it'll be your right hand on their left, grabbing like 2 or 3 fingers, usually 2 fingers, and then the same with the left hand, but with their right hand. And they'll tell you to squeeze as hard as you can. This is something that I find very challenging, not because I can't squeeze, I can squeeze with both hands, but because my right hand is so much stronger than the left that if I squeeze as hard as I can with the right hand, I'm going to hurt them, but I'm trying to squeeze as hard as I can with my left hand. So trying not to with the right while simultaneously trying to squeeze as hard as I can with the left, that's incredibly difficult, and I don't think that I'm really doing all that well with it. After the neurological exam, he asked me a few more questions, including when I was going to be going to see the neurologist at Rush University Hospital, and I told him that was at the end of October. And he told me that we were going to have to run some tests and that he wasn't entirely sure what was going on, but we would figure it out. He sent me down for another blood draw, which I had done before we left that hospital again, and he was retesting me for lupus, ANA, and the myasthenia gravis, which was a different test than the ones I had done before. At this point, I was really cautious about feeling hopeful, and I was a little bit just kind of dubious about the whole being switched up to another neurologist at the hospital, but he did seem like he had a lot of experience, so I did really hope that he was going to help me find the answers. On October 29th, we took the 2-hour drive to Chicago and saw the doctor at Rush University Hospital. He did a neurological exam that wasn't quite as thorough as the one that I had just had done in September, but it was better than some that I've had from other people. He asked me questions about my history, what led to this, and anything that might have contributed, but he didn't get my full history. He noticed in my chart that I'm seeing the other doctor at the other hospital. Of course, I don't want to mention names right now, at least. I don't know if that's really appropriate, but he did recognize the name because he was very familiar with this doctor and considered him to be one of the best in the field. We went out to the hallway so that I could do some walking for him and he could watch me stumble around, because not only am I not able to use the left side of my body very well, I'm also dizzy 24/7, so it was very awkward. Also, just a side note, this hospital, the Rush University Hospital hallway, I don't know if all of the building is like this, but this particular one had doors that didn't swing in and out. They actually slide side to side, and the hallway looked like something in a mental asylum. I had been doing a lot of research leading up to this appointment. Obviously, I went several months without being able to work, so whenever I had energy to do anything besides just basic survival, I was doing research. That research had led me to looking into things like ME/CFS and long COVID, considering that we hadn't found any other explanations for these neurological symptoms, and they were very consistent and persistent. So instead of just waiting for him to decide what he thought it was, I did actually bring that up as a possibility and asked him what he thought about it. He said that my symptoms would be a little unusual for long COVID, but it wasn't entirely out of the realm of possibility, and the ME/CFS was also possible, but that would be a long haul, basically diagnosis of exclusion. He told me that I should stick with the doctor that I was already seeing because he is very good, and if I needed anything more than what he could provide, I could come and see him again at the Rush University Hospital. I'm actually going to read something from his notes, just because I do think that he was a bit more thorough with the notes and didn't rely so much on AI to write them. Examination: alert and oriented with fluent speech, a bit tremulous. Significant titubation in a vertical fashion. Cranial nerves symmetric, EOMs full, pupils 3 mm, equal round, reactive to light, Discs flat. Motor examination revealed mild generalized weakness with some giveaway in the left lower extremity. There is no atrophy. Deep tendon reflexes 1 to 2 plus, upper 3 plus, KJ 2 plus, ankle jerks symmetrically, no Babinski. Cerebellar with mild postural and symmetric intention tremor. Gait somewhat functional with dragging her left leg as well as her right leg and some circumduction of her left leg as well. Romberg without significant sway. Sensory examination was asymmetric, diminished pin on her left side. She, however, also split vibration at the collarbone. Impression: 1. Left-sided weakness. 2. Gait disorder. 3. Other fatigue. 4. Functional movement disorder. 5. Myalgic encephalomyelitis, chronic fatigue syndrome, or ME/CFS. I do think that he put number 5 because I brought it up, but it is actually a possibility given the symptoms, and he did acknowledge that. I was, however, upset when I saw this and he had the functional movement disorder on there, because functional disorders are a combination of hysteria and conversion disorder in the modern day. He did not, however, bring that up in the appointment, so I didn't know about it until his notes came into the portal later on. After we finished discussing the possibility of long COVID or ME/CFS, he did explain to me that he was going to refer me to the movement disorder clinic, which I thought was a great idea, especially when I looked it up because they have really specialized physical therapy. He didn't order any tests or anything, and overall I honestly felt like it was a waste of time to go all the way to Chicago to basically get the same neurological exam and everything that I had had with the other doctor that was much closer. Even though I was really annoyed with still not having answers and being bounced around all over the place, I do have to give him some kudos for putting it in the documentation about my tremors and a little bit more detail about the issues that I'm having with walking and everything, and the fact that he did do the pinprick and everything so that it would demonstrate that I have a lot of reduced sensation in the left side versus the right. As for the tremors, I think I'm going to do a dedicated video on that to demonstrate it, but it does get worse the more fatigued I am, which is really interesting. I mentioned that he referred me to the movement disorder clinic, but that's not the full name of the place. It's called the Rush Parkinson's Disease and Movement Disorders Program. The Parkinson's disease part of that made me a little bit nervous, but of course when I looked up the symptoms and compared it, my tremors are not the same. The intention tremor is... Okay, I don't know if you guys know the difference between the types of tremors, but people with Parkinson's have tremors when their muscles are at rest. So when they're just sitting still is when they start shaking, whereas my tremors tend to happen when I'm moving. And the most noticeable one is with my head and neck. I have my head supported right now because I can't sit up for very long without getting the tremors and getting really fatigued and then not being able to hold my head up anymore. But when I do sit up, my head starts shaking. I don't know if you'd be able to see this because it is kind of a tiny tremor, but that happens more and more the more fatigued I get. The movement disorder clinic called me to schedule the appointment, and that was set all the way in February, so I had quite a bit of time to wait. Meanwhile, I was still dealing with the appeal for my short-term disability denial, or the extension denial rather. They approved short-term disability and then denied the extension, even though they had approved it initially on this very same condition that had not changed. Also, I had made a follow-up appointment with neurologist number 4 for the end of December. In the interim, we ended up dealing with a whole bunch of issues with the house and such, and I was also trying to deal with a lawyer for my short-term disability denial appeal. So I went through the first appeal, and that was denied, and then had to go through a second appeal. Mind you, short-term disability only lasts for 6 months. You're talking about something that should have been well into long-term disability at this point. which I had been paying for since 2017. I had also done some research on how to recover basic spinal function, and I found this channel on YouTube called Low Back Ability. I'll link that below for anybody who's interested. It's really good stuff. I've always been really good about keeping my back strong, but since I've had all of this weakness on the left side, it's something that I thought that would be worthwhile and maybe might actually help. That led me to ordering something called the Nord Stick, which is a workout bench that's really dynamic, and I think I'm going to do a video on that. So I started using that to try and strengthen my back. All of the little back muscles that go along your spine can become pretty weak, and I felt like I was definitely weaker on the left side. Obviously, I'm weaker on the entire left side, so the back would be included there. And I also was getting a lot of back pain in the middle of my back, I think from just compensating whenever I'm walking and moving around. So I was using that and doing the normal PT as much as I could tolerate, which really isn't much, but at least it was something. Then the end of December came around and I went to see neurologist number 4 again. We discussed what had happened at the Rush University Hospital appointment, and he said that ME/CFS is really difficult to diagnose, but it's just going to take some time and we're going to have to run more tests, and told me again that we will figure this out, and I actually believed him. He didn't do a full neurological exam for this appointment, which I didn't think was necessary anyway, but he did want to kind of reevaluate a couple of things, including my reflexes, which seemed to be about the same. This time he referred me for a second EMG because we were never able to get the EMG report from the first one, and he thought that it should be repeated anyway. So it was back to the waiting game. I had 2 appointments in February, one with the Rush Movement Disorder Clinic and one for the second EMG. On February 2nd, my boyfriend and I made the trip back to Chicago, but this time to a different building for the Movement Disorder Clinic. The neurologist was accompanied by a student, and I told her it was fine for her to sit in. She asked me about what had happened and all of my symptoms, and I tried to give her my entire history, but we ended up getting cut off. She did a very thorough neurological exam with some elements that I had never had done before. For instance, she wanted me to make a certain movement with my hand while saying specific things, like saying the alphabet backward or counting from like 1 to 10, stuff like that. And I had never seen that before, so I thought maybe she's testing my cognitive abilities or something, because I have had a lot of issues with that too. We went out to the hallway for the walking around test, which I expected, but she did have me do some different things with that too, like trying to lift my foot while I was standing up, which I can only do if I position my body in a certain way and kind of use my body to pick up my foot, because I can pick up my foot if my body is supported, but I can't keep it up for very long. It's very weak. When we went back in the room, we did a little bit more of some neurological exercises, and she kept making little comments to the student who was sitting in the corner about things that I thought were not accurate. Like, she kept trying to say that my tremor was stopping when I was trying to do something else while talking, which actually wasn't happening. I was supporting my head as much as I could when I was trying to do other things, just because my tremor, it gets really annoying, but it's also really painful after a while of my head shaking, and I was starting to get tired to the point that it was like I was about to basically fall over. At one point she wanted me to say the alphabet backward while I was holding my hands out. And so I started doing that, and she made a comment to the student about how I was nodding my head along with the letters when I would say them, because I do that when I'm emphasizing things when I'm talking, but also I do it a little bit more when I have to think about something and then I let it come out in words. It's almost like my head is trying to force the words out. But she mentioned that when I was doing that, my tremor would stop, and I was trying to do the task still, but I was thinking, well, of course you're not going to notice that tiny tremor when I'm nodding my head for emphasis or because I'm thinking about something that I'm trying to do that I don't usually do, like saying the alphabet, not just out loud, but backward, because I can't even remember the last time I did that. Essentially, I knew where she was going with this. I had been looking into the functional movement disorder after the last rush appointment and had studied more into functional neurological disorders as a whole. Even though it was something I was familiar with already, I just thought I'll look into the new research, and I had watched a bunch of like lectures and stuff that I could find on YouTube, of which there are many. The feeling that I got when she first came into the room, when I was there for the appointment, all the way to that point, and then the end of the appointment, it just seemed to me like she had diagnosed me before she even met me. But as I always do, I give people the benefit of the doubt, and I did the same for her, thinking maybe I'm wrong because she does work for this big university hospital and she's apparently a professor. She should know better. She did not know better. After all of the tests that she was having me do, she started asking me about stress. This was the point when I knew that she was going to go there and she was not going to consider anything else. But I still wanted to persist in trying to actually have a reasonable discussion about something that is impacting my life very severely. I had told 4 other neurologists the same thing, and I haven't mentioned it yet in these videos, so I'll just go over the whole overview of the thing. I worked Friday into the morning because I work overnight, so normally I would get off at 8 a.m. They were cutting hours actually, so I had been getting off on some days at 7 a.m. Then I had the weekend off. So I had 2 days of relaxation. I decided to just give myself the days off instead of doing work like on the property here at home or anything like that. Nothing strenuous. I just wanted to give myself some TLC. So I actually had a very nice, relaxing weekend with my boyfriend. Leading up to that Monday, I didn't have anywhere near the level of stress that I normally do. I also practice cognitive behavioral therapy every single day in the way of mindfulness training or mindfulness exercises, and I've been doing that since 1991. For those of you who are not aware, functional neurological disorders have a whole treatment plan that's supposed to be tailored to the person, but the core of the treatment plan for every person is cognitive behavioral therapy. So when this doctor started telling me about functional neurological disorder, I let her know that I was familiar with it and that I considered it to be the new age hysteria and not to be taken seriously. I call it a doctor I don't know bucket diagnosis. Whenever doctors don't have a better explanation for something, mainly because they haven't actually tried to find the explanation and instead have just relied on arbitrary testing and never getting the full patient history, they just label you with something and throw you into a bucket, and you are never taken seriously ever again. She really wanted to try and push the idea on me and convince me that it could be something that could actually help me to get better, and I told her that it was absolutely not a valid thing and asked her if she had even considered something like MECFS. She asked me to say it again and told me that she was not even familiar with MECFS. I then asked about the physical therapy because they have specialized physical therapy, and that was the whole point of me being referred, not just to be evaluated, but also to get help that I can't get elsewhere. She told me that she would give me a referral to their specialized physical therapists after I see a neuropsychologist. So this doctor, who is a professor training students in neurology, didn't get a full history from a patient who has a complex neurological disorder, decided that she was going to just misinterpret a bunch of testing and then decided to make that person into a psych patient. To say I was angry in this appointment and afterward is an understatement. I let her know that I believe that functional neurological disorders are something that doctors made up because they're too lazy to actually find the root cause of things, and that I needed to be taken seriously, and that I have a medically valid problem that needs medical treatment. She told me to let her know if I changed my mind about wanting to see the neuropsychologist. I posed a two-pronged question to her. I said, considering that I've been doing CBT since 1991 on a daily basis, and the fact that that is the core treatment for functional neurological disorder, how did I come down with this so-called disorder, in your opinion? And if that is what I have, then wouldn't all of the cognitive behavioral therapy that I've been doing daily since I came down with this disorder have cured me by now, or at least made some kind of improvement? She couldn't answer me. I was absolutely furious. So she excuses herself finally, and it's very awkward, and I resolved myself to never ever see her again and to send her notification that she's no longer going to be welcome as part of my care team. And we went to the bathroom, because of course when you have a 2-hour drive you should try to go to the bathroom before you leave. By this point I had decided that I wasn't going to rely on a cane for longer walks, because it's really, really hard on my right side, especially my right arm and shoulder, to just use a cane when I'm having to compensate so much for the weakness on the left side. So I had gotten myself a walker. And the walker helps significantly. It actually helps me to walk a lot better without tripping so much. And if I do trip on anything, it's a little bit safer than just being on the cane. So I go up to the bathroom here and I'm using a walker, and as I walk up to the door, and mind you, going into the doors, a lot of these with a walker is really awkward if they don't have the button to open the door. I have to kind of back in. But I walk up to the door and this doctor is coming out of the bathroom. I was maybe a foot away from the door when she suddenly opened the door, and instead of holding the door open so that I could come in, she decided to just kind of push in front of me and sidle away. It's not necessary to open doors for people, it's just a polite thing. But I can tell you that when I am working in any professional capacity, if I was in that situation, not even necessarily a professional capacity, I would just open the door for somebody. And I just found that really strange the way she reacted to the whole situation. Of course, I do have the bias from just being absolutely furious about the entire ordeal. I was so upset about the whole thing that I didn't even look at the doctor's notes for, I think it was about 6 weeks. But when I finally did, I noticed that she didn't put anything about functional neurological disorder in her notes. In the notes, there are 3 diagnoses, or what they call assessment and plan items: gait abnormality, tremor unspecified, and hemiparesis of left non-dominant side unspecified hemiparesis etiology. I was relieved that she at least didn't try to throw me into that bucket, because I was absolutely going to protest that and request an amendment to my records if she had done so. After that, I was looking forward to the next EMG, because I knew this time it was going to actually give us a report, and it was going to show that I have a physical problem, not a mental one. My fellow autistic adults can probably relate to having mental issues, but they don't cause your entire left side of your body to become weak and numb overnight. On February 27th, I went in for the second EMG, and the doctor who met us to do the test was very nice, and I really liked him immediately. The office was dead quiet. It seemed like we were the only people there, and he said he had been doing this kind of on the side for 3 years now. I told him what had happened last year with the other EMG, and he double and triple checked to make sure that we were on the right patient profile, and he actually showed me the screen. He went over and marked all of the nerve points that he wanted to hit with Sharpie, which is something that the other neurologist had not done. And I remarked on that, and he said, "This is the standard procedure." He told us that he likes to follow the rules and do everything by the book, and I told him I definitely appreciate that. So I went through being shocked over and over again, and the whole, needle in the muscle thing, which was uncomfortable in a few places, especially around the knee. I had started getting some feeling back around my left knee, and it was really tender for some reason. He also went up a lot further than the other neurologist did. He had only gone up to my knee. This guy went all the way up to my hip area, and the hip area that he was poking the needle into was also really tender. At the end, he said my test was normal, and I thought that was really weird because there were a bunch of places where he said that he was having to turn up the, I think it's the amplitude, if I remember right, because the shocks weren't really having the response that they should. And of course, I couldn't feel a lot of it. And when you can't feel needles going into your muscles, that really does say something. He was really compassionate, and he did go over some options that I could look into and wished us luck with the whole diagnostic process. I'm not going to read over all of this report because a lot of it is, well, charts, basically the EMG report. If you've never seen one before, I might upload this separately just so people can see what it looks like and have some idea if they're ever going to have this done, what they're looking forward to. But I am going to just read the summary. The motor conduction test was performed on 4 nerves. The results were normal in 3 nerves: left median APB, left peroneal EDB, left tibial AH. Results outside the specified normal range were found in 1 nerve as follows. In the left ulnar ADM study, the peak amplitude result was reduced for wrist stimulation. The sensory conduction test was normal in all 4 of the tested nerves: left median dig 2, antidromic; left ulnar dig 5, antidromic; left radial superficial antidromic; left sural antidromic. The needle EMG examination was performed in 11 muscles. It was normal in 8 muscles: left tibialis anterior, left biceps femoris, short head; left abductor pollicis brevis; left first dorsal interosseous; left pronator teres; left biceps brachii; left triceps brachii; left deltoid. The study was abnormal in 3 muscles with the following distribution. Abnormal interference pattern was found in left gastrocnemius medial head, left vastus lateralis, and left tensor fasciae latae. Reduced recruitment tibial nerve medial gastrocnemius. Reduced recruitment femoral nerve vastus lateralis. Reduced recruitment superior gluteal nerve tensor fascia lata. Can you tell that I'm out of practice with Latin? So of course I looked up these results and what they would mean in Dr. Google and a few other search engines, because I don't just use Google these days, and I found that the report really isn't normally called normal if there's reduced recruitment, especially in multiple muscles, so I'm not actually sure why he said the test was normal. And that brings us up to the current day. I don't have another appointment yet until April 1st with neurologist number 4, and we will be going over the EMG results then. Thank you so much for watching my story, and I will provide updates as they come. I am also working on videos that will showcase my deficits in walking, the weakness, and the tremors, and I do plan on doing some stuff that will showcase the types of physical therapy that I've been doing. I will see you all in the next episode of Fat, Sick, and Fed Up.